free to give me a call. My number is on the back of the calendars, as well as you can call here. You can reach out to me. I'd be happy to do that. Other than that, if you could please make sure that your cell phones are off. And then, yeah, without further ado, we'll get started. Yeah.
Okay. So I want to explain one thing that's very important to me is I have created some what I call icebreaker questions. And the primary purpose of these icebreaker questions is just to get the dialogue going, so you know the expertise of each of our panelists that are going to be with us today. But we really want to hear from you. So do me a huge favor, please raise your hand and ask a question at any time. There's no specific agenda for today. We would love to hear your questions so we can get the information out. And also, don't be shy, because if you have a question, chances are someone else in the audience is too shy to ask that question. So please, we definitely want to hear from each and every one of you. So I'm going to get started with just introducing each of our panelists and let them tell a little bit about themselves. So we've got John Hoagland here with Hoagland Family Hearing. John, you want to tell a little bit about yourself?
Hello. My wife Patricia and I have audiology practices throughout Southwest Florida. I've been in the field myself for 36 years, her for 34. And we started in Southwest Florida after being 14-year Braden residents with an office in Bonita Springs called Hoagland Family Hearing and Audiology. We have since opened Southwest Florida Tinnitus and Hearing Center. And tinnitus is any head noise, ringing, buzzing, roaring, clicking, and that is in a stereo. And I put tinnitus in the title to let people know there's hope, because so many people feel that they've been told, suck it up, buttercup, you're stuck with this for life, and that isn't always the case. And then we have an office by Gulf Coast Hospital in Fort Myers, right by Metro and Daniels, and we do full service audiology as well as balance. And we've just opened here in the Cape, actually less than a mile from here in the Towers, right near, if you know Dr. Winger, the ear, nose, and throat doctor. It's just south of Vizcaya on the left side of the street, and that is full service audiology too. And we do lectures throughout the community, we do health fairs within the area, and I always like Lee Health's commitment to doing things like this, as well as Senior Blue Book. I hope you give it to it.
Thank you, John. We'll jump over here to Chris, who just joined us from soccer.
Yes. Yeah, you have to forgive me. I apologize. We run. I also lead camps for our youth down in Naples. We have a camp of 85 kids that we've just moved from FGCU to North Collier, and that's quite a feat, because you got to figure with kids, they have parents and transportation. So I ran out and said, "You guys figure it out." Yeah. So,
tell us a little bit about yourself, Chris.
My name is Chris Williams, and I'm a personal trainer. I went to school for dietetics from Lamar University in Beaumont, Texas. Played football for quite a long time, probably longer than I should have. I have 4 kids, believe it or not, 3 in college. Yeah, I know. I'm telling you, I'm not kidding. You can see the grade already. So, but you know what I've done, especially when we moved to Naples, my wife and I, is there's a large group, a large concentration of the aging population, and I'm sure maybe one of the panelists have mentioned it. If not, I know they know the statistic. But 10,000 Americans turn 65 every day. And so as we're just on the threshold of this baby boom population, what we're going to see is a larger focus on balance. Because if we can prevent falls, if we can increase mobility, there's several things that happen. One, you stay active, and you stay social. And so we can decrease depression, and then we can increase the enjoyment of life. So we'll get into all that great stuff, all kind of good stuff for you. Really going to think I know what I'm talking about.
By the end of it. All right, Natalie, take it away, my dear.
Thank you. My name is Natalie Grondin. I'm a physical therapist here with Lee Health, and I have proudly been with Lee Health for 18 years this June. I'm very fortunate. I have so many wonderful opportunities. I do work with patients on Tuesdays and Thursdays and specialize in balance and vestibular rehabilitation. Vestibular is another word for the inner ear or anything connected to the areas of the brain that help with balance. And I also am the coordinator of 2 teams within Lee Health, the Parkinson's team and the balance and vestibular team, which means that I'm responsible for developing our programs and also for training our therapists in-house. In the last 5 years, I've trained probably over 50 therapists. And with that said, what we do at Lee Health is we make sure that we have a very high level of competency so that anywhere that you might go and need services, including acute care, home health, health park care and rehab center, that we have therapists that are specifically trained in balance and vestibular, because as Chris had mentioned, there's a high need for it, and so we need to make sure that we're very specialized in that area. I also coordinate a speaker series that we have here at Coconut Point, 8 weeks in a row, twice a year. Some of you may have attended already. I recognize a few faces. If you have not, please be sure to look at the Healthy Life Center event calendar, and those are announced. Usually it's around September, October, or January, February. I personally work with people who have balance problems at outpatient rehab at City Center, which is 1 mile south of Lee Memorial Hospital, across the bridge.
Thank you, Natalie. Renee, take it away.
I work on this side of the room. So my name is Renee Black, and I'm an occupational therapist, and I've been practicing for 32 years. And one of my specialties that I've been doing now for about 22 years is incorporating vision and vision therapy into my practice. Now, the way I learned this is I was in private practice for over 10 years with 2 eye doctors. And then I was at Ohio State University, and I worked with all of the optometrists, neuro-ophthalmologists, and those folks. And I've been beyond blessed to have learned a tremendous amount. So I've just been here not quite 4 years, and my specialty is anything from neuro, so any type of brain injury, concussion, stroke. I'm on the vestibular team as well. I address the vision for that group of people. Let's see, what else can I say that we can provide for you in conjunction with the other folks that are up here.
Fantastic, thank you. And I'm Amanda Barton. I'm the publisher of Seniors Blue Book, and I always like to ask how many of you are familiar with Seniors Blue Book in the audience. Okay, a good amount. How many of you actually know how to use it? Oh, a good amount. I usually get a laugh and no hands, just so you know. So you are going to get a copy of the most recent Seniors Blue Book in your bags today. And I do like to explain how to use it, just in case you're not familiar. If you're in a crisis situation and you're trying to fumble through and find resources, it can be quite difficult if you don't know how to look for what you're actually trying to accomplish. So it is an A through Z directory, the first half of the book is. So that's where you're going to find audiologists and physical therapists and elder law attorneys, financial advisors, doctors' offices, hospitals, things of that nature. So all of that is in the front half in an A through Z resource directory. The back half of the book is our housing and home care and home health grids. So this allows you to compare home care options, home health care options, and any senior housing, including assisted living, independent living, active adult, retirement communities, continuing care retirement communities, and skilled nursing. And all the questions I usually get asked in these discussions, you generally can find the information in the grids. Starting price ranges, whether they allow pets, what type of apartment sizes and styles they have, things of that nature. So that's a little bit about Seniors Blue Book, and if you're interested in learning more about Seniors Blue Book, or if you have a question, I'm always your go-to. My information's in the publisher's letter under Amanda Barton. So without further ado, we will get started with our program today. And I have, starting with Natalie, I wanted to ask you, what do you currently do as a physical therapist to help promote just optimal health in general and keeping on your feet?
Well, as I specialize in balance and vestibular, that's my #1 concern.
Yeah.
is to do a thorough evaluation to help determine what could be causing a person's decline in balance skills. And so often I would hear that people would say falling is a normal part of aging, and it is not a normal part of aging. It's unfortunate that people tend to accept that as a reality, and I'm here to say it's not. Most of the falls are preventable. But the idea is that we have to access the knowledge, the understanding of what's normal decline in physical and physiological abilities as we age, what's not normal, what can be changed, what can't be changed. And that's why it's so important to deal with people who specialize in these areas, so you can get down to why am I having problems. And there's never just one cause as we get older. So the idea is to be working with somebody who can decipher what is contributing to the balance problem. The hope is something can be done. Not everyone can go back to 100% like we were in our 20s, 30s. We notice changes, but we certainly can optimize the abilities.
Sure. And what would you say the #1 cause for falls are?
Well, there's so many factors that play into what could cause a fall, that there's never just that one cause. If there were, that'd be easy, right? We would fix it. But generally, we think of factors that can affect balance and cause falls is issues with medical conditions. Chronic medical conditions often accompany a higher risk of falling. Environmental issues. We tend to adapt ourselves to our environment, and it should be the other way around. If our homes look exactly the same as they did 30 years ago, chances are they're no longer as safe for us.
Right.
We have to consider environmental changes. Also, awareness and behavioral characteristics. If you're a high-risk taker, and you don't take time to say, know your limitations, your weaknesses, your strengths, well, you might be more at risk just because of that.
Yeah.
And of course, we're talking about cognition, so cognitive function has something to do with it. Many times, if people have poor memory, they may forget that the last time they did something, oh, that wasn't so safe, I shouldn't do it again. Or even judgment, not realizing that this is really not safe, therefore I should not do it, I should ask for help. There's just so many factors, and we don't know until we actually are face-to-face with the person. We get to do a good history, a good interview, and go from there.
Yeah.
So there's never just one cause.
For sure. Anybody have any questions so far? Okay, I'll spin back around to you. All right, John, while we're on the subject of cognitive function in here, you want to tell us a little bit about how often you should be getting your hearing checked and how it's related to your balance?
The Surgeon General has these guidelines and say at these ages we should have these medical tests with this type of frequency. With hearing, from 50 and above, it's every 5 years. And at 65 and above, they shorten it to every 2. And whenever there has been a diagnosis of hearing loss, I do recommend getting to the point of annual like you would a physical. The most important one is the first one. And just out of show of hands here with the group, how many of you at home in your medical records have a current, let's say the last 2-3 years, a current chart showing how your hearing is at all the different pitches and frequencies of sound? Okay, very, very few of you. For those of you that have those, I would encourage you, if you don't update them annually, at least every 2 years continue that path. For those of you that haven't begun, I'd encourage you to treat your hearing with the same care you're treating the other aspects of your health, and in particular, get what's referred to as a baseline hearing test. Not unlike a baseline PSA for men, a baseline mammogram for women. It's one of the baselines they really stress. Sometimes people come into our practice and they'll say something like, John, my doctor started me on 3 medications I've never taken in my life. And I think in the last 3 weeks, it's really affecting my hearing. Can you check it for me? So I'll do a test, find a problem, and they're right. It's the kind of problem the medication might be causing. So they'll ask me to write to their doctor. I'll say, certainly. So what we do throughout the area is we do these baselines. We'll give you a dated copy for your records. And this way, if in the future anything affects your hearing, and be that a TIA, a mini stroke, adult onset diabetes, a bad reaction to anesthesia, chemo's a big one, medications, radiants, where your balance is concerned and your cognitive concern. Your brain, there's a term they use called cognitive load. Your brain only has so many resources. As we age, those resources unfortunately deplete slightly. So doing a lot of things at once creates a problem. Well, when you can't understand, when you have to focus on look at people's lips, try to figure out what they're saying, it's at the expense of your brain resources going in other directions. The Pennsylvania School of Medicine did some recent research, and in your inner ear, there's a place called the cochlea that has 26,000 little hearing nerves. It's one half of the inner ear. The other half of the inner ear is in the balance arena, and I love the work that Lee Health does with helping people with these little crystals that can come out of place within that inner ear. But in the hearing segment, these electric impulses come through your auditory nerve to the auditory processing part of your brain called the auditory cortex. Your brain's basically an electrical entity. You stub your toe, electricity shoots up and tells your brain you're hurt. You want to move your hand, electricity goes down, moves all your muscles, tendons, and everything to make sure you can do what you want. When this flow of electricity stops, the Pennsylvania School of Medicine study found brain atrophy begins to set in this auditory processing. So years later, we can get sound to the brain, but the brain can no longer turn it into language. And within your circle of friends or family, you've probably heard I can hear, even when I'm wearing my hearing aids, I can hear better, but I still can't understand. So the effects of this auditory deprivation, which as the name would imply, the auditory processing has been deprived of these electric impulses, has an impact. Well, Johns Hopkins looked more into that same subject, and they found brain shrinkage began there. The only other place we'd ever seen brain shrinkage was in the cognitive arena, the memory, the dementia, and the Alzheimer's. And so that's when they published their landmark research that said mild untreated hearing loss doubles the risk of memory problems, doubles the risk of dementia, doubles the risk of Alzheimer's. Moderate, 3 times as likely, and severe untreated, meaning not wearing hearing aids. It seems to go away when you wear the hearing aids, but severe untreated makes it 5 times as likely for that. Well, this cognitive load also affects your balance. There are a lot of things you have to think about in terms of your balance. And according to this study, mild untreated hearing loss triples the risk of falls as well. We're not as aware of the things in our environment. We can stumble and trip. Moderate, where most people begrudgingly admit that there's something going on, makes it 6 times as likely. And severe untreated hearing loss makes it 9 times as likely to suffer a fall. And falls aren't a small problem. I recently looked up some statistics, and this is staggering. Every 11 seconds, an older adult is treated in the emergency room for a fall. Every 11 seconds. Every 19 minutes, an older adult dies from a fall. The 60% of traumatic brain injuries for senior adults come from falls. And falls are the leading cause of fatal injury among older adults. It's not a small thing. So I'm one of those that believes in trying to stack the deck in your favor. And so the more you're concerned about cognition and memory, etc., the more you want clear data and information going to the brain. The more you're aware of your surroundings, so you hear the dog that's creeping up behind you and you don't fall over it, and you know what's going on within your space, the better off you'll be as well. So it is tied in a very strong method.
That is so inappropriate. She didn't tell the panelists that we were supposed to.
No, I didn't tell the panelists.
You should have been more specific.
We'll go on to Chris. Any questions for John so far? We've got a few others in my back pocket if you don't. Giselle?
Hi, Doctor. My name is Giselle Garcia. I have a question real quick that I couldn't cut. You said 50 years and up that you have the hearing check every
5 years. 5 years, 65 and above every 2.
65 and up. Okay, that's
Yes.
okay. Thank you.
Yes.
Any others? All right.
So just to add to his statistics, when I do lectures, I bring in a bell, I bring a speaker, and I play this bell that rings every 11 seconds. And so people are looking around, you got some of them, going behind their ear and looking, and I tell them, I said, listen, that's pretty annoying, isn't it? Every 11 seconds you hear that? Well, what's happening is there's a senior being treated in the ER every time you hear this bell. And so then they start to pay attention. Now I've got you. Now we're going to learn something. So, and I don't know if you've seen this recent study that was published in the Washington Post and New York Times, but falls from seniors' deaths from falls are on the rise. 24,000 seniors died last year as a result of a fall. It was a fatal injury. So that's pretty significant. 24,000, that's a lot.
That's a high statistic, that's for
Mhm.
sure. Well, tell us a little bit about how making sure you do certain exercises will keep you from falling.
It's really simple. There's no reinventing the wheel here. You just have to move. Working with a lot of young kids that I work with, we actually work on balance with those guys because it's absolutely applicable in sports. And when we do that, I tell them, listen, it's time to go to Balance University. It's time to go to school. And so what we do is we work a lot of positioning ourselves on one leg, working unilateral, because what I'm trying to do, the cognitive load, is I'm trying to create neuromuscular efficiency. Some of you may have heard it as neuroplasticity. It's a big fancy word that I like to use so people think I know what I'm talking about. But hang with me. Neuromuscular efficiency, all that means is how well my brain is communicating with my muscles. The more I sit, the less that system is working. Does that make sense? Yeah. As we age, we tend to move up the corporate ladder, we tend to move less and sit more. And so what happens is we don't use that system, and we all have heard if you don't use it, you
lose it.
And that's absolutely true. And so